After the fact. All right. Good morning, good afternoon, good evening, depending on when and where you're watching this Facebook Live. This is the voice and the face of Dr. Tolulope Olabintan, CEO and co-founder of Livingspring Family Medical Center in the amazing, don't be jealous, city of Mansfield, Texas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. And today we're having conversations on the topic, Doc, I'm told I'm perimenopause. Help me through this change. And we're doing that with the awesome Dr. Victoria Aguilar.
Yay!
Yay!
Hello.
It's so nice to have you. How are you?
Thank you so much. I'm great. I'm here in California, so it's bright and early.
Oh, nice. Thank you for joining us. I know you were busy, and I really appreciate the time that you took to enlighten our viewers.
Thank you. I'm happy
Um,
to be here.
Yes, yes, yes. Now, for those of you who are watching live, hashtag live, and for those of you who are watching a replay, hashtag replay, you can tag, you can forward to those who could find this useful. Now, let's go ahead, Doc. Can you kindly introduce yourself, who you are, and what you do?
Thank you. I'm Victoria Sorlie-Aguilar. I'm a family physician. I'm here in Southern California. I've practiced medicine for 16 years. I went to USC Med School and UCSF Family Medicine Residency program out here. And I've been practicing family medicine for a long, long time, and I'm practicing family medicine. But I became very passionate about women's menopausal health. And so I myself, when I was around 43 years old, started having really irregular periods, super irregular, erratic. And I didn't really miss them much because when you're a woman, you miss your period. You're like, I don't miss her too much. And then the year I turned 44, I stopped having periods altogether. And hot flashes and night sweats and all of that,
Mhm.
couldn't sleep, all of that. And then I realized I was in menopause. And I didn't know then what I know now. I didn't know that you could go into menopause in your 40s. I didn't know that you could have perimenopause before your menopause. So I really deep dove into figure out what I could do for my own health. Because I thought if I'm a family doctor and I don't know about this, really know about this, then what about everyone else? So that's how this whole journey started. I really deep dove into it to find out what was the safest, most effective, most important way to treat myself.
Hmm.
And then when I found that information, I thought it's not fair if I just keep it to
That's
myself. I
right.
wanted to share it with everyone.
Awesome, awesome, awesome. And one of the things that you've highlighted already that you're very passionate is very obvious. I've met you before, your energy, your vibe. She's very passionate about menopause and women's sensual health because she believes all women deserve to be empowered with knowledge so they can make informed decisions about their menopause health. She's also the founder of Feminine Flame MD. I love it. Feminine Flame, and and we'll share more of her information towards the end of this program. But thank you so much, Doc, for coming on here. And I
Thank
love
you.
the fact that you are using your own experience to empower people. And so where the shoe pinches or whatever the phrase is.
Yeah.
And so
Yeah.
you're better able to empathize and also communicate how people can actually navigate this phase. So that's awesome. So my question
Definitely.
to you first is this. What is menopause for those who are watching who are like, oh, what's that?
Thank you. So, and that's why I chose, just to say, that's why I chose Feminine Flame MD, because we women, we have a feminine fire inside of us. We have so much love. We have so much passion. We take care of our families. We literally make the world go round. And I didn't want to lose that feminine fire, that feminine flame. And I didn't want anyone else to lose it too. So, menopause is when it's been 12 months since your final menstrual period. And final menstrual period is what we call the last period a woman ever has. That's the final menstrual period.
The end.
And when it's been 12 months, that means you're in menopause. So what that means is you don't know you're in menopause until it already happened to you like a year ago. And the
That's so
crazy
true.
thing is you may be in perimenopause for a few years before you ever actually go into menopause. because you might be in this situation right now. You have a period and you say you're mid-40s, you have a period, and then you don't have a period for 5 months and you go, oh, I'm going into menopause. And then you have another period and you go, oh, here
No,
comes
not.
another one. And then you go another 2 months, no period. Boom, she comes back again. She doesn't read the books. She does what she wants to do. But the reason we can figure it out is because it's not just about that period going away. Most women get symptoms that go with it, and that's their clue that this is actually perimenopause, that time right before, that 3 to 5 years before actual menopause. Perimenopause is when you have those irregular periods and you get to have the classical symptoms of menopause early.
Oh man, the joys. I gotta say,
I
the
didn't
joys.
even know perimenopause existed until I did all this research. I learned in med school about menopause very briefly. I have to say, in my med school, we did not focus on it a lot. It wasn't like a big series.
Nope.
And I really feel like it should have been. It really should have been, because it's so huge. Every woman on earth is going to go through menopause. Every woman on the face of the earth will go into menopause, yet most of us are not prepared for it. I wasn't, and I went to med school.
Wow.
Yeah.
I'm happy you do what you do, because as it is with a lot of conditions that I think affect women, it's kind of hush hush, heart disease, same things. Like it's not because we're known to endure things. We're known to just chug through. I'm not discrediting men. I'm just saying I'm glad that you are a champion for this, because it's a very important topic, and it affects the quality of lives of women and the people that love them, believe it or not. Because if you're affected, it affects the people around. People are like, what happened to her? Well,
Absolutely.
this is what's going on. And these are things that enlighten and actually help foster a better relationship, even for that woman around that time. So I have someone who's saying, Doc, all right, this is great. You're saying that I find out about it after the fact based on the symptoms. But is there a way for me to know when I'm in it? Like, are there tests that I should do? What would you suggest, Doc?
So this is the tricky part. So if you're actually in menopause, where it hasn't been a year, it's been a year since your period. And so menopause happens, the average age in the US is 51, but it can happen on average 5 years before and 5 years after. So say 45 to 55. If you're anywhere in that age range and you haven't had your period for a year, you really don't have to do a test. That's menopause. If you're before that, so say for me, I was between 43 and 44, I was having those irregular periods, but also having the classic symptoms of menopause. You actually don't have to do a test there either, because it's very obvious. Those symptoms are like, they're very, very obvious. And if a woman wants to, like if a woman's goes into menopause, say before 45, say it when she's less than 40, that would be premature menopause. She should definitely have testing to confirm the diagnosis, because going into premature menopause, meaning less than 40, that has really serious implications for a woman's health. Well, all menopause has serious implications for a woman's health, but when she goes into it very, very early, it has big implications. So she could test her hormones at that point, less than 40, with menopause symptoms. But if she's in that average 40s, 50s age range with classic symptoms of menopause and no period, their guidelines say you don't really need to test, because it's pretty obvious. Those symptoms are pretty classical.
Awesome. And I love these conversations. It's important, like we say usually with these lives, that these are medical suggestions. Make sure you have an appointment with your primary care doctor to discuss your symptoms and concerns that you may have. But very, very good. Tests are usually not needed unless you fall outside the bracket for the age range. Now, let's go right into it. You talked about you had the common symptoms, like the classic symptoms of menopause. What would you say are the top 3?
Yes. So number 1 is the one everyone's probably heard of, and that's the hot flash. The hot flash. So 70%, more than 70% of women will get hot flashes. And many people dread it. They're like, oh my God, I'm going to be sweating. I'm going to be flushed. I'm going to be hot. I'm going to be sweating at night. I'm not going to be able to sleep because of that. And it's true. Those are the symptoms. But I like to sort of shift it a little bit and say, it's not a dreaded hot flash. It's a news flash. It's a news flash brilliant woman's body, because the truth is, it's a newsflash. The Flash.
I love it.
The Flash. If you listen to Marvel, The Flash. But it's a newsflash. Hey, woman, pay attention. Things are changing on you. Some big stuff's about to happen to your body. You don't need to be scared, but you need to get prepared. You need to be prepared. If you're prepared, we can handle this. Women are brilliant. We're doctors. We're lawyers. We're teachers. We're mamas. We do everything. We can do menopause. We just need some guidance. So the hot flash, not many things cause hot flashes other than menopause. A couple of other things, maybe thyroid. If you're super young and you're 20, it doesn't make sense. But if you're in your 40s or 50s and you're having hot flashes, you're either perimenopausal because you're still having some periods, or you're menopausal because you haven't had one in a year. So I really thank God for the hot flash, because it's a brilliant mechanism. It lets us know it's one way to let us know what's going on, the hot flash. And when I say hot flash, I put that together with night sweats, because they commonly go together. And those are known as vasomotor symptoms of menopause. That's what we call them in medicine, but hot flashes and night sweats, which go together with insomnia, because if you're sweating and hot flashing and stuff, it can wake you up at night, which sounds awful, I know. But it's only awful if you don't know what's happening and you don't know what you can do about it. So that's the most, that's number one. Up to 70% of women will have those. And then the second thing is, we call it genital urinary syndrome of menopause, GSM, which is a medical terminology to say everything that happens below the belt. And a lot happens below the belt. And this is the part that no one prepares us for. This is the part that we stumble into it blindly and go, what is happening down there? And if we knew, if we got prepared, if we could handle it in stride, we just don't know. No one tells us. In middle school, they pull you aside and say, you're going to have your first period. You have to be prepared. But when you're 50, no one says, all right, get ready. This is going to get a little crazy. No one tells us. So this is me and you telling all of your audience, things are going to change, but if you know, you can do something about it. So genital urinary syndrome of menopause, I'm going to bring out a little prop here. This is, a lot of people know, a lot of women and men, but women know what your vagina is. Your vagina is your birth canal, where you have a baby. But your vulva is the outside of your reproductive system, the part you can see. It's your labia majora, your labia minora, your outer lips. It's your clitoris, which is your pleasure center. This is the clitoral hood, the clitoris underneath. Your urethra, which is where we urinate from. All this is the outside part of our vagina, vulva. So when we say genital urinary syndrome of menopause, we're talking about all the changes that happen inside the vaginal canal and outside, because of a lack of estradiol. So the whole reason we go into menopause is because we run out of estrogen. Our estrogen just kind of plummets. And when we're born with all the ovarian follicles we'll ever have. And the ovarian follicles is where we produce our female hormone. So when it runs out, all these changes start happening. And the vulva and the vagina, the internal canal, when they don't have estradiol, things start to change. We get vaginal dryness, burning, itching. We can have urinary pain when we pee. We can have frequent urinary tract infections. We can have sneeze and pee. And it's sort of like we laugh about it because what else can we do? We laugh because we're like, oh gosh, but we can do something about it. Our vulva and vagina and bladder and urethra, they're supported so wonderfully when we're younger by estradiol. And when we lose it, they're lacking it. And these symptoms happen: vaginal burning, vaginal dryness, urinary incontinence, sneezing and peeing. And if we don't have, and 80% of women in menopause will feel these symptoms if she doesn't have treatment. And it's not something inevitable, like you said, that we just have to sort of suck it up and put up with it. Although most women do. Most women do just suck it up because they don't know that there's treatment for it. And so that's the second symptom. Hot flashes, number one. Genital urinary syndrome, which includes the vulva and the bladder, that's number two. And number three is another thing that people don't often talk about, which is the mood symptoms of menopause. Women in menopause can be more likely to have depression and anxiety because we have estrogen receptors over our whole body, our brain, our bones, our heart, everything below the belt, all of that. And if we don't have it, things start to, go out of whack for us. So if we're in midlife and we're having a little depression, a little anxiety, and we can't sleep, and we're hot flashing, and we're sneezing and peeing, it can just be like, what is going on? We can start to feel conscious and out of control and kind of isolated, but not if we're prepared, not if we know what's coming.
I love it. I can feel your passion even as you're communicating. And I love the hope that you offer that these themes don't have to be thrust through, that you can actually get support and treatment and support. I said support already for these things. So emphasis on support.
Yes.
And it's not unusual. It's not unique to you, and there are resources to help. So that leads me to my next question. How do we help ourselves feel better through this season, Doc? What would you say?
And yes. So first of all, we have to get informed. We have to, if all of us are going to go through menopause, every woman on earth, then we owe it to ourselves to find out what we're in for and then what we can do about it. So if 70% of women will have hot flashes, and if 80% of women will have the vulva symptoms, less than 10% of women go get treatment for these symptoms. Less than 10%. And that means 90% or 80 to 90% are suffering in silence, or they don't know how to ask their doctor for help, or they don't know that there is help. So that's why I'm so glad you brought me on, so that, of course, this isn't medical advice. You got to talk to your own doctor because every woman's medical history is different. What medical condition she's had in the past, what age she went into menopause, whether she also has diabetes or hypertension or all the other things that a woman has. And all that matters when we talk about treatment. And we have to talk to our doctor, but we have to feel confident to talk to our doctor because they either know, because they've done some training, they know how to help us, or they can refer us to someone that can help us. But just to go over it really quickly, the really easiest thing, one of the most simplest things a woman can do is with that genital urinary syndrome of menopause that's caused by lack of estrogen. Because we're in menopause, we have no estrogen. One of the simplest things doctors can do is prescribe low-dose vaginal estradiol to menopausal women. Because low-dose vaginal estradiol is a cream, and it comes in a tube, and it can be applied just topically. It can be applied just topically to the inner labia, to the inner vaginal canal, to the urethra and clitoris. And it's usually prescribed by a doctor twice a week. And just something that simple can start to relieve a woman's burning, dryness, itching, sneezing, and peeing. And of course, augment her sensual life, because we need all of our bits to be healthy and strong and vibrant, so that we can have not only just function. We don't just want to function, like survive. We want to thrive. We want to have beautiful, sensual lives. So that's just something really easy. A woman can ask her doctor, hi, I'm having dryness and burning and urinary incontinence, and I haven't had a period for a year. Could I benefit from low-dose topical vaginal estradiol? Is that something that you could prescribe for me? And most doctors, family doctors, OBGYNs, it's a very simple thing for them to do. And almost every woman on earth can use that. The only woman who can't is a woman who has breast cancer and is taking tamoxifen or a medication like that. It's very, very small percentage of women that can't use it. Even in some cases, those women still can, but they have to talk to their oncologist. So that's one. And also for the hot flashes and night sweats and insomnia, there is treatment. There's lots of treatments, actually. There's non-hormonal treatment, which a lot of doctors know about what to prescribe. Sometimes antidepressant medicines prescribed, sometimes certain blood pressure medicines prescribed, sometimes nerve medication is prescribed. All those are non-hormonal and can be helpful. And then there's menopause hormone therapy that's prescribed for women who have no contraindications. And that's a long conversation about who can and who can't take it. And there's guidelines for that. But the important thing is that a woman feel confident enough to talk to her doctor to even have the conversation. Because if we don't know what we can expect, then when the doctor talks to us, it can just all go by so fast that we sort of, many women are left at the end of the day with no treatment at all, because it's sort of a lot to absorb all.
I love all of this. A lot of gold nuggets you dropped here. And, the resounding theme is to ask for help, to ask, for what you need, essentially, and be open about having these conversations. I tend to go right, straight to it. And of course, I'm a woman, so I can,
Yes.
I guess sometimes it's more comfortable for women to talk to women. But a good doctor, you can have those questions asked, and a good doctor will respond. And even if they can't help you, can point you to the right person to help you. If you let your caregiver, your physician, know that this is something that's affecting your quality of life, there are resources out there. You don't have to go through this alone. So thank you so much, doctor, for coming. This is so fun, actually.
Thank you so much. I'm so happy. I'll just shout it from the mountain.
I can tell. So that leads me to my next question. Doc, people are watching. Man, I like her. I like her fire. I like her energy. I like her name. How can people connect with you, either to have you come speak on their platform or to connect with you offline, to get more resources from you or to work with you? Doc, where can people find you?
Thank you so much. Well, I have a website, www.feminineflamemd.com. Feminine because, flame because of our feminine fire. feminineflamemd.com, where there's free downloadable videos about more details about menopause. And I also have a menopause mastery course where women can deep dive and go really deep into what happens. We just barely touched the surface about what happens to our body with menopause. We talked about the things you feel, but a lot of changes happen that a woman doesn't even know are happening. You don't even feel those changes happening, and they have really serious consequences for our future long-term health. So if imagine, instead of like me, where you're just like, what's happening? I'm having hot flashes. I'm 43. I don't know what's happening. And I was confused and I was anxious. Imagine instead of that, when you go into menopause, you know exactly what's happening to your body. You know exactly how to ask your doctor for help. And when you have a conversation with your doctor, you do it from a place of wisdom and confidence because you took the time to get information instead of endless scrolling and searching. That's why I built my feminineflamemd.com website. That's why I built the Menopause Master Class, so that women could get informed and get that confidence, so that they could confidently talk to their doctor and get the treatment they needed, so we could all live our feminine, flamey lives through menopause and beyond for the long run. We can do this. We just need some support. We can do it together.
And this website, we have the information about the class. Your website would have information on the class.
Yes, there's a sign in for my menopause masterclass right in there. You sign up for the wait list, and boom, we start getting information.
Awesome. This was very good. This is so good. I already know people I'm going to forward this to help them, because sometimes these conversations people are a little shy about, but it is possible to get help, even if it's looking at the resources and reading and getting more aware, like, oh, that's what's happening. It's not me per se. It's just the changes, the season I'm in. But thank you. This has been so informative. Thank you all for watching live and in replay. Of course, we know that sharing is caring, so please forward this to whoever needs it. And I've put the information on where to find you on Instagram, on your website, as well as Instagram and your website, so people can connect with you on those platforms.
Thank you.
Thank you so much for coming, Doc. I really appreciate you.
Thank you for having me. My pleasure.
Awesome, awesome. All right, everyone, have a great day. And if you or anyone you know is looking for a passionate, a thorough, and a caring family physician who will help you live long and well, and we have conversations to help you thrive, I am she. Have a good one, everyone. Bye.